This is the D&K pre-marker. We'll put a little purple ink on the foot plates that represent the 3, 6, and 9 o'clock meridians that are used as reference marks in order to orient the intraoperative axis marker. This pre-marker is angled so that we can take a direct approach, which places the instrument very comfortably in the hand. Performed with the patient sitting or standing and looking straight ahead at a distant object, and that gives us the pre-op 3, 6, and 9 reference marks that we'll need to orient the IOL axis marker. We can now set the foot plates of the D&K axis marker to the desired axis for the IOL orientation and ink the foot plates. Lining the positioning holes up with the previously made reference marks and depressing the marker onto the globe marks the proper axis for IOL orientation. This process is repeated for marking the intended axis for the incision. And now we'll show you the technique for implanting the toric intraocular lens in another patient. The incision is going to be at 115 and the IOL is going to be at 2 degrees. We're going to make a 3 millimeter groove for the toric implant because that's what I base my induced astigmatism on. But I'm going to perform the surgery with a 2-2 incision in a micro-incision fashion to give us the most stable chamber and the least trauma to the eye. Alright, we'll be using the 45-degree micro-Kelman tip designed for micro-coaxial phaco with a special infusion sleeve. Alright, and the implant goes in. We're going to use the micro-incisional technique where we do not enlarge the incision. I give counter traction with my second. As it's delivered into the bag, I'm going to rotate because I fold the lens a little bit different than most. I fold it against the opposite the drawing. And now I'm going to rotate this lens. 3 little dots near the periphery of the lens are going to be oriented just shy, just a little bit counterclockwise of the final intended axis. That way when I remove the viscoelastic, it won't over-rotate and I won't have to continue to rotate it further. I'm just teasing this along. It's a little bit difficult to see because of the fuchs guttata. I'm just teasing it along. Now we're about 10 or 15 degrees shy of the final axis placement. I do like to go behind the implant to remove viscoelastics. That Provis came out very nicely from behind the implant. We'll remove it from in front of the implant now. And you can see it coming off of the corneal endothelium, telling me it was there for protection. Did a nice job. And we'll go ahead and rotate this to its final resting place. There we go. I'm using the silicone ionate tip to make that rotation. We're almost there. We do it in small increments and then sit back and see what it looks like. That looks real good.